Hello there, and welcome to Dry Eye Girlfriend, the podcast where beauty, wellness, and science come together in the most eye-opening way. I'm Angela, your advocate, wellness enthusiast, and go-to girlfriend for all things dry eye. Sure, there's plenty of science and medical jargon out there, but where is the real talk? I created this show to raise awareness, share practical solutions, and bring you episodes with global experts, holistic health pros, industry insiders, and women just like you who are navigating the same journey. We talk about everything from nutrition and skincare to the most up-to-date science in dry eye. Because when we start connecting the dots between lifestyle and eye health, everything starts to get a whole lot clearer. Let's get into it. Hi there, and welcome back to Dry Eye Girlfriend. Today I'm joined with Dr. Taji, who is a Canadian optometrist with a strong focus on dry eye and patient advocacy. She is deeply committed to improving how dry eye is understood, diagnosed, and supported, with a particular emphasis on education, access to care, and validating the patient's experience. In addition to her clinical work, Dr. Taji is the founder of I Really Care, a non-for-profit organization dedicated to eye health awareness and patient education, as well as access. Her work bridges the clinical experience with compassion-driven care, helping patients feel seen, informed, empowered throughout their dry eye journey. In this episode, we'll explore Dr. Taji's path into optometry, what drew her to dry eye specifically, the gaps she sees in the current system, and how advocacy and education can meaningfully change patients' outcome. I'm so excited to have you here. To start, I would love to have you tell more people about you. This is their first intro to you, so everything from a little bit about yourself and then your journey in optometry.
Great. So I'm Dr. Rana Taji. I've been in clinical practice since 2010. I was US educated, and after I graduated, I stayed there until 2017. I basically worked in optometry, ophthalmology for all my career, and so I was very versed and emphasized into medical eye care and ocular disease. And I started my dry eye journey at an ophthalmology practice in the US. So that's where it really kicked off. We did a lot of surgical management over there. So wanting to really ensure that patients were ready and primed, for some of those surgical experiences when it came to not, developing dry eyes and stuff. So I really took a great passion towards preventative care on the dry eye aspect. And then I saw that there was like a growing need for it. So it was something that really just became so much more of a passion of mine, is to delve into the dry eyes. And then fast forward to when I moved back to Canada, a couple of years after moving back, I bought my own clinic. It was a retiring ophthalmologist, and she was very much into medical eye care and primary ophthalmology. So it was pretty much, I fit right in. And through that practice is where I built my dry eye clinic and expanded into advanced dry eye therapies. And that all happened around the time of COVID. So what I noticed during COVID is that there was a big explosion of patients that were needing more dry eye services and dry eye care, obviously because so many of our population was headed towards exponential screen time, right? Kids being on screens, and so there was a lot more individuals that were just requiring that access, and which is why I really decided to emphasize and focus my career on building through the dry eyes. And at the same time, I started doing the lecturing because I really enjoyed, educating my colleagues, and I just had such a passion for it, and I wanted to be able to also kind of like infect people and instill that passion in others. So when I see doctors, want to learn about dry eyes and want to do more dry eyes and really have that passion, it's so fulfilling because I feel like if I'm reaching only a few people a year, or a couple, even one person at a lecture, that kind of I ignite that fire within them, it really, is self-satisfactory and fulfilling. So that part brings me so much joy in terms of what I do in my career. And I feel like I thrive doing it because it gives me such a great sense of purpose to be able to spread the awareness to other practitioners and to other members of our profession, which is great. So fast forward to 2024, 2025, we were seeing just, an explosion of patients that were really requiring dry eye services. But unfortunately, they were financially, hiccuped from being able to access those services. A lot of people will term dry eye disease as a rich man's disease because these are services that are not covered by our government mandated insurances. Private insurances, even sometimes, a lot of the times, don't cover our services. So a lot of patients are required to pay out of pocket for them. And so there was definitely a increasing barrier to these patients that were suffering. And it got to a point where their mental health was affected as a result. And so there was a whole mental health component that I, dug into and I delved into deeper to understanding the mental component of dry eyes and how it affects patients, how it affects staff and doctors, how it affects society as a whole, right? Because there's definitely a effect of that. Then the other part was the financial barrier, right? So it broke my heart that these individuals were not able to access services as a result of financial barriers. So in 2024, I went to work on building this non-for-profit, and I called I Really Care. So I Really Care, because I wanted to spread awareness, not just about the disease, but also improve access to care. So for these patients that have financial barriers, to be able to now access these services. And that was, one of my projects in 2024 was to be able to do that. And we were able to successfully launch it at the end of last year. So now it is officially live, and it has already been in operation in effect. So we've already seen a few patients come through, and it's just been wonderful to be able to offer these services. The goal is to, for 2026, to spread awareness about this not-for-profit. So I want patients to, all across the country to know about this. I want them to know about the fact that there is an option for them. We've been very successful in being able to get support from industry in terms of like sponsorship and fundraising and support. And so the goals for 2026 are just to increase that awareness, reach more advocacy in terms of, our industry colleagues, our professional colleagues coming in and saying, hey, we want to be a part of this. And so that's the goals for 2026. One of them, which is already being made, happened today, which is being on your podcast to be able to, spread the word about it.
I love that. And it's all about awareness and advocacy, and we're both in this together, and I love what you're doing. I really see so much value in this because as I've been having more conversations with people, it's exactly what you're talking about. There's certain people that just can't afford all of these amazing treatments for dry eye. And that gap is what you're filling. And I think that this is such a huge, huge cause that really, really needed somebody to be an advocate for. So this is amazing.
So I'll give you an example. Like just yesterday, I had a patient and he has only been seeing me since October. So we've
Okay.
only been working together for a few short months, but he has been dealing with his dry eyes for 10 years.
Mm.
And as a result of his dry eye situation, he has lost his job, you know, his
Wow.
relationship imploded, and is basically fully dependent on the support that his parents have been providing for him.
Mm-hmm.
And he's basically like, in these past 10 years of me bouncing from doctor to doctor to doctor, I have incurred, over like thousands of dollars. And they've been financially supporting me to be able to access his care. But up until this point, nothing has really worked. And so
Mm-hmm.
I'm at a point where they're about to financially cut me off. And I'm in a place where I just don't want to do this anymore.
Mm.
He's talking about just like going through life.
Mm.
And that's heartbreaking, right? So because of
Absolutely.
that financial barrier, his mental health is severely affected.
For sure.
So, that's something that thankfully I'm in a position where I was able to say, hey, we have this program now.
Mm-hmm.
Help. And that's great for this individual, and I hope that this message is able to resonate to other individuals that are in the same situation where they want to become productive members of society again. They want to be, back at family events, at the dinner table, not just hiding out, not just, in closed dark rooms where they don't feel like, they can be a part of society because of this invisible disease, right? Because so many
Mm-hmm.
people don't understand it because you don't see it.
Right.
So a lot of these individuals as well, they get met with frustration by their family members and friends because they're like, well, what's the big deal? Just put more drops in.
I know.
Can't be that bad.
I know. And it's so much more than that. It's so much more than that. Can you explain what that level of support could look like? Is it the same across the board? Is it very much individualized? How does that look?
So it's basically just kind of a sliding scale based on like their income level.
Mm-hmm.
So, if they're under the federal income guidelines in terms of like them having a certain income level that falls below what the federal government considers like the Canadian poverty levels,
Mm-hmm.
they qualify. And
Okay.
sliding scale of like 5 to 15% that they would have to contribute on their own, depending on
Mm-hmm.
where their level falls. And that money essentially just gets funneled back into the program to keep it operational. It's not about like the doctors say taking a cut or anything. It's just about keeping the program running to be able to provide more access to even more patients.
Yep.
And so it's heavily subsidized through the compassion program, but there is a minimal, contribution that they would make on their part. But when we look at the scale of what a treatment costs and them paying, as little as 5%,
Yeah.
it definitely just is a game changer for these individuals.
Oh, it's life changing. That would be life changing for a lot of people, for sure. And so, can they access this through clinics outside of the GTA? Is there a network or at least an establishing network that's happening right now? Can you give us more information on that?
So, given the fact that we just kind of like became operational within the past couple of months, the goal has just been to basically develop a streamline of an efficient process to be able to bring these patients in and ensure that the program is running in a smooth, efficient, and effective manner. One of the next stages is to spread awareness to colleagues in terms of allowing our colleagues across the province and across the country to be able to say, hey, Rena, I want to be a part of this philanthropic mission.
Mm,
Patients that cannot, you know, access my services because of, financial barriers, and I would like to be part of this dry eye compassion program. And so I've had, a few like doctors reach out here and there in terms of like how can I get involved. And so the goal is, I would say even by mid-year is to have started up this network so that it's not just, to the GTA. Right now, at this stage with the launch, it is specific. They, other clinics like are funneling their patients to us because we haven't yet provided a mechanism for them to start it at their clinics. But the goal is to definitely be able to have, let's say a doctor from North Bay say, you know what, I can give you 4 patients a month that I'm going to do through the dry eye compassion program, or X amount, how many ever patients each clinic is willing to offer philanthropy, like on a philanthropic basis.
yeah, I love that. I love that. And I'm also thinking from a future perspective where this can go from an advocacy standpoint. You and I talked a little bit about, even the government relations side of things, and dry eye is very much underrepresented when it comes to being a chronic disease and recognized by federal, healthcare plans, that kind of thing, Ontario healthcare plans or provincial healthcare plans. So, where do you see the future in that as well?
I don't want to say the end goal because there's never going to be an end goal. There's always
No.
going to be moving targets in terms of like expanding this, to the nth degree. But advocacy on a policy level is one of the pillars of the dry eye compassion program. Once this is, accessible across the province, across the country, and we have definitely stirred up awareness, the next step would be, to lobby provincial and federal government to come in and say, hey, we want to be a part of this because we see just the societal economic impact that dry eye disease now has on society. It is such a big burden. And
Mm.
I think that, we haven't even begun to quantify from a like financial perspective
Mm-hmm.
just how much, these individuals that were productive members of society and are no longer being able to do that, and they've lost their jobs and they've lost the ability to work and contribute. I don't even think we've been able to like put a number on. I suspect it's not just millions, it's billions.
Yeah.
And
Yeah.
so I think that, also like a cost benefit analysis of investing into a program like this is going to be very beneficial for the government. And so policy implementations and changes around that when it comes to the government getting involved is 100% one of the pillars of the program in terms of bringing that advocacy to the government.
I love that. And I think that that is such a huge missing gap as well. What are the other pillars that you're focusing on? Education being one of them. I was just on the website and we'll leave those in the show notes too for people to check out. But there's so much wonderful information in there as well, where, sometimes people are asking me for resources and I will 1000% use this as a resource for people because the educational component of this is huge. So I'm assuming education as a pillar, if you want to elaborate even on that.
Absolutely. So the first pillar is about, increasing access to those people that are unable to access these services due to financial barriers.
Hmm.
Our second pillar is about raising awareness and education across the masses, right? So whether that's, with other professionals, with other, societies, with other people within the industry, and then as well with our colleagues. So the education piece is very important. And as a side note to that, like last year I did, start up individualized and small group workshops for clinicians to be able to expand their dry eye services, expand their dry eye knowledge in a setting where they are heavily involved in terms of like their education. It's interactive. So I felt like, I've been lecturing for 4 years now, 5 years. Oh my God, in 2026, we're going to say almost 6 years, right?
Wow.
I'm dating myself.
Time is flying though. That's the thing.
It is. So the lecturing has been fabulous, right? But
Hmm.
we all know we go, we sit in a lecture, we sit in a seminar. It's a group of 50, 100, 200 people, sometimes even as big as 500. And you feel very intimidated to raise your hand and ask a question or take part. And so a lot of the
Hmm.
times, we go, we listen, and we leave. And very few people end up kind of like implementing what they hear, unfortunately. And that's
Hmm.
just the nature of the game. The lecturing as the years have gone on in terms of people's attention span and focus is just not there as what it used to be. And what I found was, when I did a pilot workshop a couple of years ago through another educational institution, we did these small workshops for 10, 15 doctors, is that they just came away with like, they felt like, oh my God, like there was so much information, but not just that, like I got to interact. I got to ask questions. I was able to um, feel free to engage, whereas I wouldn't have never thought to have raised my hand or speak up in a large lecture hall.
That's wonderful to create a comfortable learning environment. And, so much nurtures from that.
So we set up like both individualized and then I had a group one. And then, the group one sold out within like 3 weeks of the launch, which was
Wow.
amazing. Right? And I only
Wow.
limited it to like 6 doctors. But it was an all day and they were able to basically have the program very like I would say, I don't want to say streamlined, but very intensively geared towards them participating and partaking. Whether it was them learning about procedures or them actually having to participate in like a ground rounds discussion on how they would treat a case or treat a patient.
Hmm.
Um, and then down to even like just bouncing ideas off of each other, like me kind of like watching them talk about, how each of them does something in their clinics. And so that level of interaction is what really made me feel like this is the next step to furthering education,
Hmm.
taking education on a different route, more of the interaction, more of the engagement. And so that was kind of like another initiative that I had launched in 2025. And then I had done several other, individualized workshops, like sitting one-on-one with another doctor all day, same thing, interacting,
Wow.
engaging, basically customizing it to their individual needs. Because these were individuals that had gone to all the conferences, they had gone to all the lectures, they had watched all the webinars online, but they still did not feel like they had the tools in order
Mm-hmm.
to implement. There was just something missing.
Yep.
And so I think that, when they came in, because now we have this dry eye space that has an educational part to it and a teaching facility, and they got that one-on-one, it's almost like it was the confidence that they needed to be able to move through and take it to the next level, which I had not seen in my 5, 6 years of lecturing,
Mm. This
right?
is
Like, I
this
hadn't.
is such a great part of that ecosystem, right? Like we need more doctors that feel confident and are equipped to treat more dry eye patients because that population is growing. And this is such a key component to that. And it's phenomenal work that you're doing.
Thank you. And this was something that like really stuck out to me last year was
Hmm.
moving away from the large mass lectures
Hmm.
to more smaller groups, the more, individualized approach, so that it really does make a difference.
Yep.
Not to say that the other stuff didn't make a difference, but we were really trying to like make big waves now.
Hmm.
And
Hmm.
the big waves was the I don't want to say hand holding, but the very like individualized, customized approaches.
Yeah.
And
And
so
that matters because there's certain things that, you know, just need a little bit more clarification or comfort, and then it can be implemented in practice.
absolutely. And so
Hmm.
that's essentially, everything that we started in 2025 is just moving into 2026, leaning into, raising the awareness about I really care, expanding more on the education front with the workshops. And so that was the second pillar, which is the
Yeah.
education. And then the
Yeah.
third pillar is about the advocacy and the policy implementations with government. So that one will come a little later.
Yeah.
The first two are being, executed hand in hand, spreading awareness about dry eyes and
Yes.
the barrier to access and trying to improve access for our patients. And the next step is education. So, I think we did a really good job with our main website for our clinic in terms of the education. And
Hmm.
then when we launched the I Really Care website, it was like we wanted to make sure that patients had access to that information, right?
Yeah.
And we wanted them to be able to have it on a portal where it was also separate from the clinic so that they could understand that like, you're not going to be pressured into, hey, I now need to be a patient. Like,
Exactly.
or hey, now I got into this program, I'm going to sell you X, Y, and Z.
Hmm.
It doesn't work like that. It's legitimately just because we had spent so much time and effort, developing the content and the effort, and the knowledge base on that website, and so we linked it so that patients could have just access to the information.
Which is wonderful. I think that that is a gap that I definitely see in my community. You know, more and more people are having that aha moment of, oh, I have what you're talking about from a symptom perspective. Where do I even go? Where can I learn more? And these resources are so important, especially because of where foundationally they're coming from as well. And I think that that's really wonderful work. And I'm really excited to, get as involved as I can in 2026 with you as well to,
I'm so
meet all those
happy to have you
pillars.
on board. You have no idea.
Oh, I'm so excited. Are you able to share a little bit about the work that you have planned for 2026 and what that's going to look like?
Yeah, so the first and foremost is on a provincial level. So as you know, we spoke about this earlier. We are going to be going to the Ontario Association of Optometry meeting in Ottawa in March, and so I think that that brings the largest gathering of Ontario doctors to the biggest continuing education meeting. So to be able to have a presence there, to raise awareness about that, I think is phenomenal. I
Hmm.
think the next step as well is to in addition to speaking with you today, and hopefully it's going to reach a lot of people,
Yep.
is to continue to access our social media channels, anyone that we know and can connect with, to reach industry, to be able to help spread awareness about this. So that's kind of like first quarter goals for
Mm-hmm.
2026 is to really implement the awareness. And first and foremost, across our colleagues, so that we can work on developing that network to improve the access. Because the more clinics that know about it, even if they don't necessarily want to get involved, at least then they can have a place where they can direct their patients.
Exactly, exactly. And that's important. Just having that, in their toolbox too will help for sure.
And I have no doubt that, we've got colleagues all over the country that are just so passionate about dry eye disease, and they really do care for their patients, and they really do see what I'm seeing, that,
Hmm.
once the awareness is out there, there's going to be so many people that are going to want to do this.
Oh, absolutely. I think so too. I think it's going to be a pretty incredible year for I Really Care. I love this. So it's really exciting. Is there anything else you want to talk about today to just complete our conversation
A lot of people
around?
probably want to understand like where this came from, right?
Yeah.
And so it did come first from a place where, I was seeing so many patients that were affected on a mental health level. So
Hmm.
that was the biggest thing. The biggest thing was is that I saw just how much it affected people's mental health because of the fact that their quality of life and productivity was affected.
Yeah.
And so, a lot of the times these advanced patients that have so many mental health issues because of their quality of life and productivity being affected, it kind of causes them to unfortunately spiral. And when you have a patient like that, it puts a pretty heavy burden on the doctor because the doctor feels that,
Hmm.
especially if you have like an empathetic side to you, then you end up kind of feeling the feelings that they have.
I've heard this across a lot of doctors. Like it's a heavy, yeah.
It's you take it home, you lose sleep over it, you think to yourself, what what would happen if I can't get them to a better place? If I can't convince them to just keep going and not give up, and if they give up halfway, right? I and knock on wood, I'm so happy and so fortunate that I have not had to ever deal with individuals so far that have taken that step, right? That unfortunate step. But you read about
Yeah.
it, we see it on
Yeah.
support groups, we see about it on the news, and so in the past couple of years, when I started seeing these patients, it became so real
Yeah.
that what if that next patient is mine, right? And so it weighed very heavily. And there was
Hmm.
a couple of years ago, I remember where I kind of had to take a step back and I had to say, I need a little breather. I just need to regroup
Yeah.
and try to like, I don't want to say detach because we never really detach, but in terms of just kind of like focus on how I can ground myself to know that I'm doing everything that I possibly can.
Hmm.
And so that's why this kind of came about because there was the mental health part, but then the horrific part to it was the patients that suffered from the mental health but
Hmm.
didn't have the finances.
Yeah. And knowing that that's the gap, and especially in I hate saying this, but in a Canadian environment where, we do pride ourselves in taking care of our own. And in this particular disease state, it's just not recognized with the type of support I feel like everyone should be entitled to. And it's gonna get there with, platforms like this non-for-profit that you're doing. It's huge. I think that this is so important to fill in that gap.
And that's where I came from initially was just like, okay, there's such a gap.
Yeah.
This is a disease. It's these treatments are a necessity. And so like interestingly enough, in the past month, I've had like several patients come and said, can you write me a letter for my insurance? And we've developed these templates, luckily.
Oh,
So it's
good.
you don't have to like write them from scratch anymore because it was a little bit, challenging at the beginning to like get these insurance letters written out. And I had a patient just this week email saying, I got 50% of my treatment covered by my insurance.
That's
I'm like,
huge.
this is unheard of. Like, we have not
Yeah.
seen insurances outside of like a health savings account or a flex savings
Yep.
account being able to cover these treatments.
So this
And
was an actual third-party insurance company, not
yes,
a healthcare.
yes,
Okay,
I know. So
that is surprising, actually.
it is. It's very much so. Flex savings accounts, they can do whatever they want. They
Sure.
can they can put their drops towards their flex
Yeah,
savings
but
account.
not everyone has access to that. That's
But
more
IPL,
rare.
radio frequency, like blepharotic exfoliation, these are not procedures that the private insurances even cover. It's not. If you
No.
look at your benefits, right? What is it? Vision exam every 2 years,
Yeah,
glasses or contacts, and that's it.
period.
Maybe they'll add retinal photography,
Yeah,
but that's about it, right? Nothing else gets covered. So to be able to see a couple of our patients now turn back and say, my insurance covered a portion of this
that
is
is huge.
phenomenal. So there
Yeah.
is, I know there is definitely advocacy going on the insurance level. I've spoken to, several of my colleagues at the Canadian Association of Optometrists who have said that they have been working very hard on the insurances.
And I also think because you talked about it a little bit too, is industry getting involved in it as well from, their market access standpoint. So that's another piece to the advocacy story here as well.
Absolutely. And listen, like I will say this, if you're industry and you're listening,
Yeah.
definitely please, if I have not reached out to you already, reach out to me. I would love for you to be involved. I think this is something that, every single industry partner that is in the eye care and dry eye space should definitely be involved in, because this is the wave, this is the opportunity for us to really expand and grow and increase that awareness. And so if you are industry and you have not gotten involved yet, please do.
I love that message, and I will definitely take that message across my network as well because I think it's so important, and industry makes the biggest difference when it comes to helping patients.
And you know what? Like I've always said from the beginning, right? Even for to other doctors when I'm training them or lecturing, and they're like, "Oh, this is industry sponsored or whatever," and I say, "Listen, at the end of the day, when something gets launched, a new product or a new treatment or a new service, you're not going out and researching it on your own.
Hmm.
You are oftentimes learning about it from industry because
Hmm.
they are the ones that are putting in all the work to spread the message and educate and spread the awareness about it. So, yes, of course, there's always going to be a financial incentive for the industry, but they're the ones that really are our biggest supporters in terms of advancing our causes.
Yeah.
So they're key integral partners.
Yeah, and at the end of the day, I think because I've been on the industry side of it for a very long time, it always comes down to educate the doctor and it's their decision. That's such a fair playing field, right?
Without losing your authenticity as the doctor, without
Yeah,
losing your autonomy, without losing what you went into this for, which is to care for people.
yeah,
So that's
yeah.
that's essentially the message.
Such a great message overall. This is such an exciting project. Again, I am so honored to be a part of this in, the capacity of the podcast and other ways that we're going to partner this year, which is going to be so exciting. Are there any other final thoughts that you wanted to leave with our audience before we wrap things up?
I think please, if you're suffering, first and foremost, know that you're not alone. And know that like as dry eye doctors, we do see you and we do hear you and we definitely do understand. A lot of us, believe it or not, got into this because it's personal.
Hmm.
I suffer from dry eyes myself. So I know the pain.
Yeah.
I know how much sometimes it can affect. Like if I'm sitting all day in front of my computer working, my eyes are in intense pain by the end of the day,
Oh,
right? So
yeah.
imagine, you know, individuals in society where over 90% of society is in front of a computer 8 to 10 hours a day working,
Mm.
right? So
Yeah.
I feel the struggle and the pain. And my goal is to make sure that, as many people are possible continue to remain functional and productive members of society, but also that, they continue to have a good quality of life. And
Yeah.
so that's the biggest thing is I want you to know that, you guys are seen, you're heard, and we're here from you. We're here for you. And please, like, if this is something that is definitely a barrier for you, reach out right now if you're in the GTA area. If you're not, and you have a dry eye doctor in your area, let them know about this. And they
Yeah.
might not know about it. And so let them know about this. And then That way we can definitely work together to spread the word about this.
Absolutely. And so if people want to reach out to you directly or follow you or, get more information about you, what are the best channels for them to do that?
So the website address is www.ireallycare.ca. So I spelled EYE. Email is just info@ireallycare.ca. You can also reach me on Instagram. It's IEYE Dr. DRTAJI. So I'm on Instagram at iDrTaji. And then those are really the best methods. So reach out through the not-for-profit I Really Care. Our information is also on the website, or feel free to message me on Instagram, and I'm happy to assist you in any way I can.
No, I love that. And again, a huge thank you for joining today. It's been
Thank you so
such an
much for having me.
insightful and thoughtful conversation. And again, the work that you're doing with I Really Care is going to make such a big difference. Grateful for your time, your perspective. And to everyone listening, thank you for being part of this community. I hope that this message gets to you. And if it's not for yourself, but for a loved one, please. Reach out to the resources that we're putting out here. And again, thanks for listening, and I'll see you next episode. Thanks for tuning in to Dry Eye Girlfriend, where beauty, wellness, and science come together to support your eyes and your life. If today's episode helped you feel seen, gave you that aha moment, or just made you feel a little more understood, share it with a friend, subscribe, and leave a review. It helps more women find this space and feel less alone on their dry eye journey. Remember, dry eye isn't just something to deal with, it's something you can manage with the right support, smart choices, and a little girlfriend guidance. I'll be back soon with more real talk, expert tips, and conversations that keep your eyes and spirit feeling bright. See you next time.